There's a hidden truth that most seniors will never hear from their doctors. Every year, millions of seniors undergo routine screenings thinking they're protecting their health. But what if I told you that some of these tests, the ones your doctor insists are essential, could actually lead to unnecessary procedures, complications, or even increase your risk of serious conditions like infections or cancer? Recent reports reveal that up to 30% of medical tests in older adults result in overdiagnosis and overtreatment, causing harm without any real benefit. And alarmingly, the vast majority of people over 70 aren't aware they're being overscreened. One of these screenings, topping our list, is linked to false positives that drive thousands into invasive surgeries each year. You won't hear this from your clinic, you won't see it advertised, but the evidence is clear in medical guidelines. Today, we're exposing it all. In this video, the 5 health screenings you should reconsider after 70 and the surprising risks they pose to your well-being. All supported by expert recommendations, and you won't believe what's at number 2. Before we dive in, drop a comment below. Where are you watching from? Your age? And have you ever second-guessed a screening or procedure? Do you think seniors are overscreened? We're reading every comment and responding with tailored advice. And if this resonates, hit like and subscribe for more eye-opening health tips. Now let's get started with number 5. Why it seems routine, but could spark a chain of unneeded interventions. Number 5, bone density scan. It sounds straightforward. A quick, painless scan to check your bone strength and spot osteoporosis. But after 70, routine bone density scans, known as DEXA scans, often do more to create anxiety than to prevent problems. Bone thinning is a normal part of aging, much like losing some flexibility or energy. Yet, results frequently show mild osteopenia, pushing doctors to prescribe medications that may not help. Guidelines from Choosing Wisely warn that treating mild bone loss in low-risk seniors over 70 lacks strong evidence of benefit, with drugs like bisphosphonates carrying risks such as jawbone death or stomach issues. A study in the Journal of the American Geriatric Society echoed this, showing these meds cut fracture risk by just 0.3% over 5 years in older women, while side effects were far more common. Consider Eleanor, a 72-year-old avid gardener who got a routine DEXA at her annual visit. No falls, no pain, but the scan flagged osteopenia, landing her on alendronate. Within months, she had severe heartburn and stopped gardening due to discomfort. We switched her to natural boosts, vitamin D supplements, walking with weights, and foods like yogurt and kale. A year on, she's fracture-free and back in her garden, stronger than before. Unless you've had fractures or major risk factors like steroid use, skip the scan. Opt for lifestyle tweaks, balance exercises, and nutrition, which studies show slash fracture risk by 20% or more. But wait, the next one could lead to something far riskier, needless brain biopsies. Number 4, brain MRI for mild headaches or forgetfulness. Seniors often worry about occasional headaches or minor memory slips, prompting doctors to order a brain MRI for reassurance. But in adults over 70, these scans typically reveal normal age-related changes, like small spots or slight shrinkage, that aren't problematic. The real issue? They trigger panic and a flood of extra tests. Choosing Wisely guidelines advise against routine neuroimaging for uncomplicated headaches or mild cognitive concerns, as it rarely uncovers treatable issues and often leads to overtesting. A review in Neurology found that over 80% of MRIs in seniors with mild symptoms show irrelevant findings, with only a tiny fraction benefiting from intervention. Take Harold, a 78-year-old former mechanic who mentioned forgetting names at checkup. His MRI showed white matter changes, common in aging, but it spiraled into anxiety and a referral for a spinal tap. He withdrew from hobbies, convinced of dementia. A simple cognitive assessment later proved it was normal aging. We focused on sleep hygiene, puzzles, and hydration. His sharpness returned in weeks. For mild issues, start with non-invasive cognitive tests or lifestyle adjustments. They're effective without the stress. Now number 3 hits closer to the heart, literally. Number 3, cardiac stress test. If you're over 70 and mention fatigue or mild chest discomfort, a stress test. Walking on a treadmill while monitored might seem like a safe check for heart issues. But for those without clear symptoms or high risk, it's often inaccurate and harmful. False positives soar to 40% in seniors, leading to invasive follow-ups like angiograms. Choosing Wisely explicitly states, don't do stress cardiac imaging in asymptomatic patients unless high-risk markers exist. A Java study confirmed over half of procedures post-stress test offer no life extension, but risks like bleeding or kidney damage from dyes are real. Meet Sylvia, a 71-year-old yoga instructor who noted tiredness on inclines. A stress test flagged ambiguity, leading to a catheterization and stent. for a minor blockage that wasn't the cause. She suffered kidney strain and a week in recovery, all while her issue was just dehydration. Better options: a simple resting ECG or lifestyle checks like blood pressure monitoring per guidelines. Reserve stress tests for true symptoms like pain on exertion. Number 2, colonoscopy for routine screening. You've likely had one or more, but after 70, and definitely past 75, routine colonoscopies aren't always wise without symptoms. The PrEP laxatives dehydrate, sedation risks cognitive fog in seniors, and the procedure can cause tears or bleeding. USPSTF guidelines recommend stopping at 75 for most, as benefits dwindle. A large JAVA study of over 1 million seniors found just 2 lives saved per 1,000 procedures in those over 75 versus 20 complications. Note, while focused on other cancers, this aligns with over-screening trends in seniors. Think of Victor, a 76-year-old golfer with no symptoms but pushed for a repeat scope. A tiny polyp removal caused perforation, landing him in the hospital for days and derailing his active life. He'd had clean prior tests. No need. Alternatives: home stool tests like FIT, which catch most issues without invasion. Discuss family history first. And now, the top offender. Number 1, full-body CT or MRI scans. Marketed as premium preventive packages, these whole-body scans promise to spot everything early. But for asymptomatic seniors over 70, they're a radiation bomb, up to 500 X-rays worth, potentially causing cancers themselves. Choosing wisely warns against whole-body scans for tumor detection due to false positives sparking needless biopsies and anxiety. Models estimate they contribute to thousands of avoidable cancers annually with no proven life-saving edge. Laura, a 74-year-old volunteer, opted for one in a wellness package. It flagged a harmless lung spot, leading to a biopsy that infected her and sidelined her for months. All benign. Experts say, target scans to symptoms only. Listen to your body and stick to evidence-based checkups. There you have it. The 5 screenings that might seem protective but can backfire after 70. Medicine is amazing, but overdoing it steals quality time. Always ask, is this necessary? What are the downsides? True health comes from smart choices, activity, nutrition, and rest. Share your stories below. Has an unnecessary test affected you or a loved one? Let's chat. Thanks for watching.